Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is Doug Jansen. He is the Ryan White AIDS Program Coordinator. It's all about take the test, take control, and we're going to chat about National HIV Testing Day, which is coming up June 27th. It's Doug's first time on the show. First of all, welcome to the show.
Thank you very much.
Now, this topic that we're going to get into today certainly has a bit of a stigma. It's a bit of a taboo as far as people wanting to discuss it. Open up about it, right? So let's start there.
Okay, absolutely. I think it's been somewhere over 30 years that HIV/AIDS has been something that Americans and the world have had to deal with, and it's still not something that people want to talk about. It's something that you get through either sex or intravenous drugs, and I think that's really the reason. That would be my guess. I try to get young people in particular to talk about it when they start a new relationship. And they always say to me, well, how do you bring up the conversation? You know, right. Particularly young women, they'll say, okay, I just got tested and I feel better. I feel like I'm taking control of my own health, but how do I bring this up to my new boyfriend? They're gonna think that I'm, thinking something weird about them or something. And often I try to give them a little taste of my personal situation and hope that my experience will provide some measure of clarity to their own situation. My former partner, has now been deceased for 10 years. We were together about 3. And not too long after we started dating, we were exclusive, and it was actually my decision to stop using condoms. And we actually argued about it for quite a while, and he was pretty adamant that we continue to use them.
By the way, that would be an argument with a heterosexual couple, regardless, or gay couple, it doesn't matter.
Any couple,
right.
That's right. And I had been getting tested every 6 months, as I thought most responsible single people did, and just assumed that he was doing the same. He had sort of indicated that he had been doing that. What I wasn't aware of was that he hadn't been tested in 6 years.
Wow.
After being with him for 3 years, he got sick. We ultimately learned that he had an AIDS-related lymphoma, and he died within 3 months. And I now sometimes wonder if I had insisted at the beginning of our relationship to see documentation of his test, if perhaps he'd still be alive today. He would be living with AIDS, but he'd be alive. And, so I give myself, that little balancing situation, asking him about his test and dealing with his death. What's the more difficult situation?
How about once you found out that he had tested positive, how long did it take for the thought to turn around on yourself and say, well, wait a minute, what about me now?
That was immediate.
Yeah.
I was sitting next to him when he got the information from his doctor on the telephone, and I saw him write down on a piece of paper, ELISA. So I knew that that's what this was. It was an ELISA test. It's usually the first line HIV test that they run. And immediately I thought of my daughter. At the time I had an 8-year-old daughter and an ex-wife to support. And I remember thinking, I can't be positive. This is not right. He can't be positive. This is unreal. Like, this can't be happening to us, is what I was thinking. It was a very unreal, surreal situation, I guess, to me at the time. And unfortunately, it played out that he died very quickly. I'm lucky to this day. I remain negative, and I'm here. I've seen quite a few other people die in my lifetime from the virus, from the disease, and it's an unfortunate thing.
Now, and this happens with almost everybody when they decide to get involved with a cause, it's almost always because of a vested interest, something that happens to them personally in their life or with a loved one or somebody very close. And I would imagine that's how, you kind of got involved with, in some way to start out getting the word out, learning as much as you can about the disease and advocating.
Actually, for me, it was more of an interest, I think specifically because I'm gay. I had started doing some volunteer work for what previously had been an organization called AIDS Project Hartford, and I had volunteered for them for about 4 years. And in various capacities, I had been a buddy to 2 different men who had died. And this was long before I met my former partner. So for me, not so much, actually. I just felt an obligation to my community to do this.
Now, when you had mentioned that you had seen a lot of others pass away with the disease around you, people knowing your story, did you become sort of a support structure for them or a sounding board for them, a person that they could ask questions and just kind of get some sense of relief on their part, maybe?
Not really.
No?
I think just being an adult gay male is enough so that you'll meet people that are eventually going to become positive, and some of them are probably going to die. I think it's just, especially at the time period,
Right.
now not so much. They've got some great medications out there now. There's so many people that now become positive and can stay undetectable they no longer will change your life expectancy.
And I was going to ask you this later on in the show, but since you brought it up, considering how far back this goes, and obviously you do get vested in it, you try to learn as much as possible, you see research and development, how has progress gone? Just like you mentioned, you could be in situations where, it can be undetectable at some points, right?
Mm-hmm. Yeah, actually, they're still working on trying to find a cure, but I think they're really a long ways away from that, unfortunately. They're also still working on trying to come up with some sort of a vaccine. I think they're probably a ways away from that as well. So really, one of the major focuses is on making sure that we locate all the people that are positive, that don't already know that they're positive, and getting them into care. If someone gets into care and takes medications, there's a pretty good chance they can become undetectable, so that the virus is basically so low in their bloodstream that it is undetectable. And if you're undetectable, you are almost always uninfectious. So you're pretty much unable to pass the virus along to someone else. So that's really where the focus is right now, to get people who are positive to be undetectable so they won't pass the virus along to others. So it's like treatment as prevention.
Some people might not understand the difference between HIV and AIDS itself. Tell them what the difference is.
Yeah, HIV is a virus, and that's what passes from one person to another. AIDS is really a medical diagnosis. When your immune system gets attacked and it gets down to a certain level, then you're said to have acquired AIDS.
Right.
So you really have to have had HIV for a while, usually a number of years,
right,
for most people.
The thing that's diabolical about it is whenever like a disease is cured or there's some significant progress, the way that progress occurs is you enable your immune system to be able to fight off whatever it is that's going on. And the problem with AIDS or HIV, once it turns into AIDS, is it's attacking the very thing that your body uses to fight off infection of any kind. So,
right.
I mean, that's what makes it so tough for the medical community to try to figure out a way to fight this thing.
Right, and the virus replicates so quickly in your system. People can have hundreds of thousands of copies of the virus in their bloodstream in no time at all. It's very quick to replicate.
You had mentioned your personal story. Here we are, fast forwarding to 2014. You're not about your physical condition, but your mental outlook. Are you a happier person now? Are you a positive person now? Obviously, you are in the sense that you come on a show like this and to try to get the word out about what we'll be talking about, National HIV Testing Day. But for you, there's a bright future. For everybody, there is, right? Trying to put a positive spin on it.
It is not like it was before. I can only be thankful that HIV has not touched me as it has so many people of my age group. So many people died. So many people had to endure AZT and some of the other horrible medications that were all they had back in the 80s and early 90s.
Does that kind of medication not exist anymore? And
Actually, they still use it.
Really?
But in lower doses and for very specific matters. I'm just really thankful that, I was one of those cases where it didn't happen to me. So, and the future is different than it was. Unfortunately, there's a lot of derision within the gay community itself and within positive people. There's sort of this, like two different encampments. There's the longtime positives and there's the newly infected. And they're not...
Do they not see eye to eye about the proper course of action to take or how to live?
No,
really?
Not at all. I'm on social media a lot.
Yeah.
As part of my job, and it's very difficult to watch. I try to be as inclusive as I can be. It's my nature to do that, but I don't see a lot of that in the community.
So there's a faction out there that just wants to be sort of isolated, or
I
what
don't know
is
about
it?
isolated. I think there's a lot of angry people that have endured a lot of hell.
Yeah.
And they're still hanging on by a thread. And then you've got a lot of new people, younger guys, who have not had to go through the stuff that so many other people have had to go through. And they look at the world through rose-colored glasses. It's a very different place.
Is it that they don't understand it all, so they can't really have as a negative outlook to the future, or are they just more positive people, or are they from a generation that sees the potential for maybe a better life down the road?
I think maybe all of those things,
Yeah.
but I think they also haven't seen all of their friends die. So many of the
Good
people
point.
that are still surviving from, say, 30 years ago have witnessed, 100, 200, 300, 400 deaths. One of my coworkers said to me, he's been to countless funerals and wakes. He can't even remember how many. And if you've gone through something like that, you really probably cannot connect with someone who's newly diagnosed, is on a cocktail that does not have any of those same side effects that you had to endure, and all of your friends are in the same boat, and you're going on cruises, and you have your job, and you've never lost housing, and your family still loves you, and, it's a wonderful thing.
Yeah. Doug Jansen's the Ryan White AIDS Program Coordinator. We're going to get into that, what he does a lot more. Is there a website for people to go and learn more as we take this break and come back?
Actually, you can go on our Community Health Center site. You can always talk to me. I am on Facebook, Twitter, Tumblr, and
all the social
Instagram.
Media, huh? Yeah. we'll put the Community Health website up on the screen for people to go, and we'll take a break. I'm Sean Murphy. This is For the Record. We've got a lot to get to. Stay with us. Welcome back to For the Record. I'm Sean Murphy. My guest is Doug Jansen, Ryan White AIDS Program Coordinator, which we'll learn what that title means. We talked a lot in the first segment about your personal story and just some basic definitions, but one thing we didn't get into was statistics, and that's something that really can stick in a person's mind when they hear some of the staggering numbers, correct?
Yes. It's probably not necessary to talk about the whole world. I think it's easier just to kind of focus on our own country. The United States today, there's an estimated 1.2 million people living with HIV and AIDS. And pretty much since about 94, 95, we've had approximately 50,000 new infections every year.
Wow.
Yeah, those are pretty staggering numbers.
And the U.S. Apparently gets more positive diagnosis than all of Europe combined, or something along those lines?
Yeah, I wish I could remember the site, but I read a study not too long ago that we have more new infections every year than Western Europe combined.
And we're not even talking about those who are walking around without being tested and not being aware that they might be infected, right?
Well, no, actually, that 1.2 includes, there's about 20% of that 1.2 that are unaware that they're positive. And actually, that's one of the reasons why testing is so important.
Right.
You're actually the most infectious when you're first infected. So the sooner you get tested and learn that you're positive and then get into treatment and on medication, the better off you are and the better off the rest of us are.
Take the test, take control. How did it come about?
That's a national campaign. I'm not exactly sure. I think it was federal. So I think it was either a CDC or a Department of Health that came up with that slogan. So we've been using it now for about a year, I think.
It's pretty appropriate, too. National HIV Testing Day happens to come up June 27th. Talk about that a little bit.
Yeah, June has been kind of the month for testing, I think now for about 25 years, something like that. Typically what we've done in the past is test at our home office in the lobby. And this year we decided to do something a little different. The 28th, the following day, is Hepatitis C Awareness Day. And we decided to combine the 2 days and have an event in Middletown on the South Green and bring an awareness to both HIV and hepatitis C testing together. We have an actual sort of a carnival fair on the green, hoping to bring people in, and then when they're there, talk about both of the viruses and actually do testing.
Does it make sense to combine them like that to get more people to the event, get more people involved, and maybe raise that much more awareness?
You know, they're not the same virus, but I think so. We talked a lot about the virus itself, HIV, and we haven't really touched too much on stigma. I mean, we mentioned it, but the stigma surrounding HIV is huge. People are afraid of it. They often don't want other people to know that they have it. If they do, they sort of live in secret. They often won't even seek treatment for that reason. People are afraid to get tested. There are still upwards of 30 states in the United States where they have criminalization statutes where in some cases you can actually be arrested for having sex with someone just because you're HIV positive, even if that person doesn't become positive from having sex with you, and even if you disclose. So there's just a lot of stigma surrounding the disease. There's also a lot of stigma surrounding hepatitis C. And it's difficult to get people to want to get tested for something that there's so much stigma surrounding. So I think it's good to talk about both of them. Our idea at this particular event is just to normalize testing itself, not so much the viruses. Just bring up the topic about getting tested, remind people that when they go to their doctors, just ask your doctor to get tested. You're probably going to have blood work done at your annual physical.
Aren't they trying to get that included as like part of the blood test when you do get your physical or
yes,
your
there's a push for that, but it's not universally accepted yet. At our health center, at Community Health Center where I work, it is an opt-out test, meaning it's going to be done unless you personally opt out of it and say, I don't want that. So they will tell you when they're taking blood, we're going to be testing for this, but you can say, no, I don't want that.
We should mention that Community Health Center, it's all over the state. There are many locations to make it convenient for people to go to, correct?
Yeah, we have our main facility on Main Street in Middletown, and there's 12 other health centers around the state. But all total, there's about 200 places where we have some sort of health care offered between school-based health care, our WIA centers, which is wherever you are, WYA, which is healthcare for homeless, and home health care for the farmers, migrant farm workers. We've got all kinds of different programs. So we are actually literally all over the state. I think there's only one town in the state where we don't have someone that can be seen.
Yet.
Yet.
Yeah,
That's right. We're working on it.
That's right. How does insurance handle the testing situation? Is it usually included, or is it an out-of-pocket thing? How does that usually work?
Well, at our office, where I work out of, we're actually right around the corner from the main facility. Our office is called Oasis. It's a drop-in center for people with HIV and AIDS, and we offer all kinds of services for people with HIV and AIDS. There's medical caseworkers, there's transportation, and we offer free testing of both HIV and hepatitis C through any weekday. Usually recommend that people call, but it is possible some days to walk in and get a free test.
You are the Ryan White AIDS Program Coordinator. For those who aren't familiar, the name Ryan White, talk about that.
Yeah, Ryan was an amazing young boy he was a high school kid, or a middle schooler, I think, at the time, in the early 80s, mid 80s, who had acquired HIV through a blood transfusion. He was a hemophiliac, and he was the first person to come forward who was not gay at a time when HIV was really thought of as a gay issue. He was a brave young man. After it was discovered that he had HIV, the school where he went to school decided that he couldn't come to school. The teachers and the parents of the other students were afraid that he was going to infect them, the other kids, and there was a huge lawsuit, and I guess it was Kokomo, Indiana, and eventually his mom ended up moving him to another town, but I think they won the lawsuit. So the federal program that pays for HIV and AIDS services still to this day bears his name.
Program coordinator, what are your day-to-day duties? Obviously advocating, coming on shows like this and talking. You're sort of like a de facto PR person too, right?
Actually, that I usually refer to myself as a salesman. I'm basically selling the facility, whatever it is that we offer. Mostly the care that our providers can give to people with HIV and AIDS.
You talked about the stigma of it, okay? When people learn more, when they get educated, and they learn that, contracting it may not necessarily have anything to do with a person's sexual orientation. For example, maybe they get it through a blood transfusion or something like that. Once they understand that and learn more, does it become a bit of a less of a stigma at that point for them? Or is that always going to be in the back of their mind?
Well, stigma is really a two-pronged or two-headed monster. There's the stigma from without, and then there's the stigma from within. And you really have to attack both ends. It's a tough beast, and a lot of people have a hard time dealing most with the stigma that they internalize.
Yeah.
And I think it's just tough. It's tough for a lot of people. And I think in our society, medical issues generally are just not well accepted. We all hear a lot about youth, how in the United States youth is valued so much. I think health is also valued. We tend to look at people who don't have perfect health as being less than. And so I think that, having HIV and not having a perfect immune system is a notch on your belt. And a lot of people have a hard time accepting that and thinking that perhaps down the road they might, have to deal with some sort of serious health issues that maybe someone else wouldn't have to.
Let's take one more quick break and come back. I'm Sean Murphy. This is For the Record. We'll be right back. Welcome back to For the Record. I'm Sean Murphy. It's been a great show. Doug Jansen's the Ryan White AIDS Program Coordinator, but also a counselor, a friend. People have questions. You're a perfect person to be able to help them out, correct?
Yes, I'm not a medical provider
I
sure.
know. Yeah, but listen, just a shoulder to lean on, to just have someone
Yeah, I've got
be
a
able
good
to
ear.
talk to. Yeah, that's
I've got a
key.
good ear.
A website or email address for people to go and check out?
They can always go onto our community health center site, chc1.com, or they can write to me if they'd like. I can answer whatever questions I can and forward them perhaps onto someone else who might have some more information.
I'll tell you what,
I
we'll
just
make it
bleeped
real
out.
easy for you.
Yeah, you're just going to
Put
put
it up on the screen for
Yeah,
you.
That'd be easier.
Now the website has all the information as far as the National Testing Day and all that, and other events that are coming up.
Yeah, that's the one thing. There were two things I wanted to mention. We didn't talk about PrEP, and I wanted to talk about the event. Do we have a couple of minutes I can throw those things in?
We sure do.
Okay.
Go ahead.
One of the things that's available now for people that wasn't available previously is a drug program called PrEP, which is basically, it stands for pre-exposure prophylaxis. So in addition to condoms, now someone who's negative, who wants to stay negative, HIV negative, who's having sex with people and may or may not know their status, or is actually having sex with someone who is positive, or might be having sex with someone who uses intravenous drugs, can take this drug and hopefully remain negative. All the test results so far have been really good, and both for heterosexual and homosexual couples, the results have been really positive. So this is only newly available. It's really controversial in the gay community, particularly between older people that have been positive for a long time and new people. But now this is available, and that's a wonderful thing.
Good stuff.
In my estimation.
Take the test, take control. It's National HIV Testing Day, which is June 27th, and your event at your office, June 28th in Middletown.
Actually, it's going to be in the South Green in Middletown, and it's called the Mad Hatter's Testing Day. Testing party, Mad Hatter's Testing Party. It's going to be a carnival, a little crazy, stuff for kids, people of all ages. So,
you can see this show and many others on our YouTube sites. Until next time, I'm Sean Murphy. This is For the Record, thanking Doug Jansen for being a guest on the show today. Thank you, and we will see you next time. Take care.